In the average woman's lifetime, she will spend approximately $1,773 on tampons. This isn't even including the cost of pads and panty liners. But there is another option, and I would like to inform women about menstrual cups, how they work, what they are, the pros and the cons of menstrual cups. So I actually have one right here. This is a menstrual cup. This one, the brand is Diva Cup, but there's many other brands that you can get. It really just depends on your body and which one fits the best. So a menstrual cup is a bell or dome-shaped cup that holds 1 ounce of liquid, up to 1 ounce. It generally has a stem on the end so that you can reach and pull it out with this, and then you, usually menstrual cups are made from silicone or latex rubber, and there are pros and there are cons to using a menstrual cup, just like there are pros and cons to using tampons or pads. Menstrual cups have been around since the 1930s, but in America, they weren't manufactured until 1987. So they're fairly a new concept for Americans. The shape and size is solely depending on manufacturer. For instance, Diva cups look like a bell with a little stem on the end, but some are shaped more like a diaphragm and expand to catch the blood. Okay. It's important to find the right fit for you and your body. Generally speaking, there are 2 guidelines, one being if you're younger than 30 and you've never had a child, you can get one size, or if you're older than 30 or you have had a child, you can get the other size. Me personally, I am under 30, but I have had a child, so I would use the one that's for people who are older than 30 or have a child. So there are many pros to using a menstrual cup. The biggest one is that it saves you a lot of money. One menstrual cup costs around $40. I think this one costs $35 at Walmart. But depending on brand, we'll say $40. And they can last for 6 months to 10 plus years with proper cleaning and proper care. So that's a huge savings on money because it changes it from spending $1,773 in a lifetime to possibly $40 in a lifetime. Another thing is that they are eco-friendly. A lot of them, like this one, are reusable. You use them and then you can take them out and wash them and then use it again. They also hold up to 1 ounce of liquid, so they can be left in for 12 hours at a time. You can keep it in all day, and then when you get home, change it. You just take it out and dump it, and then clean it, put it back in. And the fact that it holds 1 ounce of liquid is twice as absorbent, or twice as much liquid as super absorbent pads and tampons. Some other smaller pros would be that there's less odor because the blood is not exposed to oxygen. With disposable cups, which there are disposable ones, with disposable ones, they often say that you can have sex with it in, which means that there's less messy sex. And cups Diva cups or menstrual cups can also be worn with an IUD inserted. They're also safer than tampons because there's currently no threat of toxic shock syndrome. There are some cons to using a menstrual cup. The removal can get messy or embarrassing or both. If you're in public trying to remove it and then having to clean it in the public sink can be kind of embarrassing and messy. It can be difficult to find the right fit because every woman's body is different, so it's trial and error. It can be hard to get the hang of learning how to insert and remove menstrual cups. But once you know how to do it, it's not so hard. And you do have to clean it. You do have to keep it clean. You clean it in the sink while you're using it, and then when you're done with your period, you can boil it in hot water or boiling water. And the other is that there's an increased chance of infection if you don't clean it well enough. But just make sure you're cleaning it well enough. When a woman has her period, she has a few different options of what products she would like to use. Some women go for pads and tampons, which are more socially what we've been using. But menstrual cups are another option that are eco-friendly, less expensive, less or safer, and they hold more and you can keep them in for longer. And it's difficult to find the right fit sometimes, and it can be difficult to learn how to insert and remove. So there are cons as well. The woman should make the right choice for her body and talk with her doctor about her options.